Hello. Let me introduce myself. I'm Dr. Stephen Berman. Originally graduated with an electrical engineering degree. I have a master's degree from the George Washington University Medical Center, where I studied human physiology, graduated there 40 years ago. Additional PhD credits at the University of Kentucky's Medical Center, and then my doctorate in chiropractic from the Western States Chiropractic College in Portland, Oregon in 1984. Today I'm going to introduce chiropractic as I would to a new patient coming into the office. I'd be taking any patient in and asking them whether they've been to a chiropractic office before and whether they had or not. Because the services of chiropractor are very varied, I point out that many people have had chiropractic services for problems with the necks and back. I've heard about that. That I'll be adjusting all the different parts of the body, arms and legs, hands and feet. As a patient comes in here, I'm always thinking they may have things that are current, recent, on top of things that may have been lingering from unadjusted, unattended chiropractic issues that are lingering from childhood, or even as long ago, lingering from our first injury, which is really not a medical issue. Thank goodness not broken or bleeding, but misalignment is well accepted, generally not evaluated for our children, nor treated at the time of the injury. So anybody coming in to see me, I'm always thinking has issues that may go as far back as their first injury at birth, childhood injuries, or issues that are more recent. I'll start by showing these two books here. These are by Dr. Forrester and Dr. Gregory. Dr. Forrester and Dr. Gregory are both medical doctors prior to studying chiropractic. This book here in my right hand is written in 1923. The one in my left hand is from over 100 years ago. It's written in 1910. I'd like to show the pictures that you see here are not unlike the pictures of me giving adjustments I've shown you just prior to this. These were the adjustments, the services of a chiropractor that our ancestors felt were important, that they wanted to have preserved and passed down through time till someone finally comes in to see me as they will today. We've always had women and men in chiropractic from the very beginning. How is it that I'm here at all? What is this 12-letter word chiropractic? This is Dr. Palmer. Dr. Palmer is our first chiropractor. He's not the first to give an adjustment, but he's the first to write it down. Someplace in a cave someplace, somebody gave a hug. It went pop, typical of a chiropractic adjustment, and that person became the cave chiropractor. But that knowledge was found and lost through the generations until Dr. Palmer comes along. He gives an adjustment, the person gets better, he writes it down now. Gives another adjustment, the person gets better, he writes that down. He writes a book, opens a school. This is his wife and his son, one of our first entering classes. I'll paint a little picture. Dr. Palmer is living on the Mississippi River in 1895 in the city of Davenport, Iowa. So we have, at that time, riverboats going north and south, railroads going east and west. People are riding on the backs of horses in horses and buggies. Now, prior to 1895, many influences have already arrived in America from around the world about health and well-being, about how to help each other function better. With the railroads in 1860s and 1870s, well before Dr. Palmer in 1895, Asian healthcare arrives in America with the Asian railroad workers. From Europe, we have tractions and pills and potions, hot baths and cold baths. We have massages, we have drugs, we have surgeries. We have all kinds of things people do prior to 1895 when then Dr. Palmer comes along and starts providing chiropractic adjustments. And it's the chiropractic adjustment that separates chiropractic from all other services that I've already mentioned. Now, in an office that someone might have been to in modern times, hopefully the chiropractic adjustment is offered, but along with the chiropractic adjustment, all kinds of other services, hot packs and cold packs and tractions and electrical stimulating machines may be offered also in a chiropractic office. But to our ancestors, chiropractic meant only the providing of the chiropractic adjustments, and that's what I do here today for patients that I will be seeing. Dr. Palmer can't take care of all the people who want to see him, so he starts teaching. I emphasize that people come by horse and buggy from far and wide, by riverboat and such. They don't come to town 3 times a week. They come to town 3 times a year. In many offices, it's suggested that for chiropractic to be a success, many treatments per week for many weeks might be necessary, but it could never have been the standard when people came by these transportation means. And again, I hope to always provide a service that's useful for a person, even in a single treatment, that would have been allowing chiropractic fame to spread as it did back in the 1895 era into the early 1900s, when it became so popular and so many people went away from medicine and surgery that the medical doctors, in collusion with the sheriffs up in Iowa, had Dr. Palmer arrested for practicing medicine without license. He defended himself by saying what we do is not taught in medical schools, examined by medical boards, or practiced by medical doctors. So it can't be the right charge, practicing medicine without license. We're practicing chiropractic, a separate and distinct healthcare service, and people are willing to march in the streets, politic in the State House. People know that they now want the services of a chiropractor, just like they want the services of a dentist when they want the services of a dentist, and they want to find either of them in jail. And the chiropractic roundups continued in Texas, where we are right now, until 1949. In Louisiana, the roundups continued until 1974, when the last 2 chiropractors were arrested. Currently, we're hearing that in Asia, in Taiwan, that chiropractors are being arrested currently. But we expected everywhere that chiropractic is being repressed, services of chiropractic are not available, the backlash will occur as it did in this country, and that the people will continue to march in the streets, politic in the state houses, for the right to have their chiropractic adjustments. The big story in news was not about insurance. For many years, for 75 years, one license law was passed in one state, and the rest of the states were still arresting. Then another state would pass a license law, and the rest of the states are still arresting around it. So for 75 years, it's a perennial story, lost to some of our family histories, or some of our ancestors who did go down and demand that every state house passes a license law, every governor signs that law, so that finally chiropractic is obtained in all the 50 states. But during this period of repression, we have not attracted the very best students to our chiropractic colleges. But for several generations, for many generations, over 100 years now, the very best students have not been encouraged to come to chiropractic colleges by their coaches and their counselors from their high schools and their colleges. So that now we do have chiropractors who've entered our profession that maybe have not been at the level that would have been allowed to stand behind Palmer. This was like an NBA, WNBA team standing behind Palmer. He expected them to get it in the hoop every time, not 3 times a week. He expected them to play from court level, not on top of some electrical stimulating machine or other device. And that's the type of practice I hope to provide continuously now today as we move into the future. But that type of practice has been widely lost now, so that many chiropractic offices, trying their best, do feel that they need to have 3 times a week and use additional tools such as machines. But again, none of that would have been recognized to our ancestors when they went to a chiropractic office. Now, as I mentioned before, chiropractic has always included more than just the necks and backs. Pictures here from 1906 of adjusting the feet. And all this went before me, and this march through time has been accompanied by chiropractors of both genders. As there's a place for everything in life for men and women, there was a place for the lady chiropractors in the jails also, as the chiropractic roundups were indiscriminate and took all the chiropractors into the jails. But the public demanded that male chiropractors as well as the female chiropractors be both allowed to study chiropractic, take care of the patients that came to see them. These are all lady chiropractors. Now, I've shown you obstacles placed in front of chiropractic. When chiropractic has flourished, little known story is Dr. Spear's story. Dr. Spears writes this book in 1925. By 1983, he has a 600-bed chiropractic hospital in the big city of Denver, Colorado, to handle all the people coming to see him and his staff for the same adjustments I've shown you consistently through all these pictures. And only adjustments. And recognizing that the very first injury was, in fact, as early as these pictures in 1925, it was recognized our first injury is a misalignment and deserves attention. Now, take care of all kinds of people. This is a picture of Rose. Rose appears on this cover. She has her natural talents, as we all have our natural talents, but chiropractic problems would have gotten in the way of her expressing her natural talents. By giving Rose adjustments at critical times, she was always able to continue to express her natural talents until she shows up on the cover of this magazine here. I like to say to anyone, I like to see what I can do to help get you onto cover whatever magazine you'd like to be on and dancing with whatever stars you'd like to dance with. So with that in mind, that is time to now turn to the patient and find out what brings him in to see me. Again, I'm Dr. Stephen Berman, and I'm going to be interviewing Kevin today. He's a new patient to me. He's been to a chiropractic office before. I'm going to ask him, as I ask everybody who comes to see me, to point where it hurts, to tell me what brings him to see me, but to show me with his hands as he goes. Kevin, do you have an area that has your attention first as you sit here right now?
Right here.
And just like a detective story, I'm going to be putting a timeline and everything. I'm going to be asking about every joint in your body eventually, not just the major area. I'll be trying to line up all the suspects, see who the culprits are, see who knows each other. Let me ask, first of all, about how long has this been bothering you?
15 years.
Has it been worse recently, in the last few days, weeks, or months?
In the last 2 days, or actually the last week, because I got worked on. I got some body work done.
Let me ask you this. All on this side or mostly on this side? How about the other side?
There's a little bit of referral pain on the other side, but it's almost all on the left side.
Got it. Now, mid-back, upper back, neck. You may not have these as your major areas of complaint, but if you had one place to point to, or one area to show me, would you have one place to point to, one spot that has your attention? Mid-back, down here?
The lower back is the worst right now.
Use your left hand back there. Is it more on the left side, you think?
Yeah, it's a little bit more on the left side.
Okay. And again, mid-back, upper back, neck. Do you have any one area that bothers you through those areas, more or less one side or the other?
Mid-back and left side a little bit
more. A little bit more on the left.
Mm-hmm.
As you use your hand here, does it come all the way up here to the base of your skull or more down your shoulders?
It does both because
Both?
I have some arthritis in my lower back and neck.
As you use the word arthritis, I'm going to be looking at only chiropractic issues. Arth means joint. An arthropod is a jointed creature. Itis means inflammation. Bronchitis, sinusitis, arthritis. So many people have inflamed joints, but I'll be looking for a chiropractic reason for the joints to be arthritis, to be inflamed. So yes, even though you have other diagnosis, other names for it, let's see what chiropractic issues you actually have in these areas. Has this been worse recently during the last few days, weeks, or months?
Yes, over the past week because of the body work, unlocking it.
Again, things are a little stirred up right now.
Mm-hmm.
Knees, ankles, toes. Any one knee, any one ankle, any one toe, anything different left or right? Old injuries, numbness, tingling, knees, ankles, toes?
If I were to do squats right now, my knees would burn. I don't have much cartilage in my knees.
Again, you mentioned not much cartilage, but again, we'll look for chiropractic issues. A lot of times we may think something's structural, but in the same area there may be misalignments.
Mm-hmm.
Let's remove the misalignments. That's what I intend to do by giving thorough chiropractic adjustments. And then you'll be better able to tell whether it's structural issues versus chiropractic issues. Sometimes when we remove the chiropractic, what we thought was structural turned out to be chiropractic all along. Mm-hmm. Again, that's what I'll be doing is diagnosis by trial therapy. Give you a trial of chiropractic adjusting, thorough chiropractic adjusting. The things that get better must be chiropractic. If it doesn't get better, maybe not. Let me see what it turns out. Do you think one knee is more so than the other?
I think they take turns. I think the right might be a little bit worse.
Very good. Ankles, feet, and toes. Anything? Any old injuries? Any one toe? Any one foot? Any one ankle?
I've tore the right ankle, the ligament, about 4 or 5 times.
About how long ago was your last injury here?
It was only about. I did a very mild roll of it about a month ago.
And you still feel residual right now?
Month and a half, yeah.
From that last time. Okay.
Mm-hmm.
Other side? Not really.
Other side is okay.
Okay. Numbness, tingling? No.
No. I've got plantar fasciitis, but that doesn't really count.
Well, I don't know. Everything, it may be chiropractic when we look at it because we have multiple bones and all through. And again, that's a medical itis, plantar,
Mm-hmm.
bottom of the foot, fascia,
Mm-hmm.
itis. Let's see if we can find a reason for you having it. Possibly there's a chiropractic issue there that it's been lingering and left unattended to. Let's see what we figure out today. Do you think that whatever you call, whatever you call it, is it more in one foot than the other?
Yeah, it's only on the left.
Only on the left. Very good. No, not very good. Good that I know about it.
Mm-hmm,
Good that you have it. Let me see if I can help you. Shoulders, elbows, wrists, and fingers. Same kind of question. Any one shoulder, any one elbow, any one wrist, any finger?
I've torn both shoulder girdles like 4 or 5 times.
Again, use the word tear, but again, we'll be looking for chiropractic issues in the same area that may explain maybe lingering issues. But as you point up here, do you think one side is different than the other, or more or less?
The right side is worse than the left side.
Okay. And again, has it been same kind of repetitive questions? Worse recently, last few weeks or months?
Yeah, it's been worse recently because of the body work.
Let me ask you to go down now to the elbows, wrists, and fingers. Any one elbow, wrist, or finger? Numbness, tingling? Anything going on? Elbows, wrists, fingers?
Yeah, I've got like carpal tunnel and tennis elbow type stuff.
Type stuff. I like the word type stuff. Again,
Yeah.
we can try to figure out what chiropractic issues, and you'll be the first to know if something changes. Maybe it's been lingering in chiropractic all along. If it doesn't change, well, maybe not. But that's my intention, is to try to give you a chance to differentiate chiropractic from non-chiropractic issues by thorough chiropractic adjusting. Other elbow? Not really.
Both elbows.
Both elbows.
Like that.
One more than the other? Point to this one first.
The left is worse, yeah.
Let's get down here now. Wrists and fingers. Any one finger bothering you more than any other, or anything going on here?
I broke my left wrist in high school, and so I have a dormant ganglion cyst, so I just don't ever hyperextend it.
Again, let's see if we can remove any irritation. Maybe there's been something there that's been misaligned, causing something to irritate, a cyst to form or something like this. Let's just see what happens. You'll be the first to know of any changes. Other side, not particularly.
Just a little bit of carpal type stuff on the right. It's not a big deal though.
Numbness, tingling?
Only when my carpal gets really bad.
You feel it come down your hands?
Yeah, I feel it come down, especially this side of the hand.
Now again, you mentioned from here to here, but you also pointed, of course, up here. So the nerves that go to your hand really originate way up here. So as we limit something to calling it carpal tunnel, this or that, we really limited our diagnosis to just one region where that same nerve extends all the way down. Let's just see what we figure out as we go.
Right.
One more series of questions. Headache. Is headache part of your life?
No, it's not.
Issues of the jaw. People call it popping, clicking pain. Can't bite on one side, TMJ, lots of names for it. Is that part of your life?
Yeah, I got a little bit of TMJ on the left side. I grind.
Something that, again, my repetitive question, something that's been worse recently, something that's been going on for a long time?
It's been going on for a long time.
Issues of breathing. People call it sinus, they call it allergy, they call it congestion, they call it I can't breathe through my nose, I can't breathe on one side, I can't breathe at night. Lots of names for it. Is that part of your life?
I got a baseball bat to the nose when I was a kid, and then any time I sparred, it would re-injure it, and so. Yeah.
As you sit here right now, do you feel like you can breathe better or different on one side or the other?
I guess my left side is better right now.
But it may shift around a little bit?
Yeah, I can shift around.
All right. And you mentioned that injury, I don't really ask your age, but you mentioned back in years ago you had this injury to your head, but about how many years, roughly decades ago, or?
Yeah, it was like 4 decades ago.
40 years ago,
Yeah.
that you had a bump, okay.
Roughly.
Even at this time, misalignments can still be lingering and waiting to be resolved even after all this, even after that amount of time, meaning that a cut heals in 7 to 10 days, a broken bone heals in 7 to 10 weeks, a ligament may heal in 7 to 10 months, but a misalignment may stick around for 7 or 10 decades until it's realigned. So let's just see what we figure out as we go. There is, even for these old injuries, possibly chiropractic issues that are still waiting to be attended to. I think I have the questions asked and answered that I need to have asked and answered, and I would then proceed to giving you some examinations here on the table and proceeding with adjustment after that.
Okay.
Kevin, if you come over here now, and I'll have you lay face up, please. Lay on your back, face up. We'll just slide down just a bit here. Okay. Kevin, I'm going to check a couple things as we get ready to get started here. I'm going to check your leg length, see how you're laying here right now. Now, as I bring you together, this foot hits about a finger above the other one.
Mm-hmm.
If you peek down your body, you'll see that this one lays out more, and this one lays up more, and this one's a little bit above the other one. Most likely, you have a twist like this, put one side up and the other side down, some in and out. And that some of your discomforts are coming from back here where I'm touching back here. Right here we have these two dimples. Just like this is the dimple where the elbow joint, well, we all know about that. These two dimples are at the joint between the triangular tailbone, the sacrum, where it joins to the iliac portion of the hip bone. So they're called the dimple joints, or the sacroiliac or SI joints. With the pubic joint up front, it makes a ring we call the pelvis, and the ring will get twisted. And when it does, we see one side pulled up compared to the other, leg turned in and out, pain at the level of the dimple. Now, the consequences of that are many. Once you're up like this, whole body has to compensate. One foot has to hit differently, the knees have to take a different course. They would like to go like this, but once you're up like this, they have to go like this. Let's see what we figure out as we go. I'm going to start way down here. We'll work all the way up and out your arms. We're going to do many different adjustments. We'll do some sitting adjustments, face down adjustments, and eventually we check you even beyond that. Kevin, I'm going to have you take a nice breath in. And breath out. Here we go. And again, breathe in and out. Good. We're on our way. And one more time, breathing in and out. Here we go. And again. And one more time. Good. We'll come back later for more. Breathe in and out. Here we go. And again. Here we go. Ho. Good. Good. One more time. Breathe in and out. 10 for 10. Very good. Now, cross your forefoot. And across your forefoot. I'm going to have you take a hold of the top of the table above your head. Hold on to the headpiece way up here. Good. That's to keep you from coming down the table. Just hold on up there. I'm going to swing you here. You may feel this all the way up. Breathe in, breathe out. Hold on. Oh yeah, big time. Bend your knee. Out like a flamingo. Up here. Continue to hold on. Breathe in and breathe out, Kevin. Here we go. And back again. Good. Excellent. Hold on. Here we go. Swing with me. Hold on. Nice. Bend your knee. Good. Out like a flamingo. Good. Up here we go. Hold on. Both knees up, please. I'm going to have you press my hands together. Squeeze me. Push. Let's check for the front of the pelvis. Hold me. Good. Drop this leg down. Come a half turn up in your hip like this. Yes. Now this one comes right to that sacroiliac area. Let me take your hands now. There we go. This brings that right into play now. The first portion of this is to position you. This is not the adjustment yet. I'll let you know before any adjustment. Here we go, Kevin. We need position first. There we go. With your next breath in and breath out. Here we go with an adjustment. Here we go. Yep, right on target. Nice. And back. And good. And smile. Yeah. Now you're allowed. All right, you felt it down there. Now, your heels are hitting equally now. The feet are starting to point more symmetrically in and out. You felt the popping down there.
Mm-hmm.
Okay. Bring this knee up. We're not done by any means. That's a good start, though. Here we go. We're going to go to the other direction. These are two adjustments are not really for one sacroiliac or the other. They're for both of them in this direction. The other one is that direction. So we'll see what happens. Breathe in, breathe out. One side, the other side, both or neither. Oh, yeah. All right. And again, just dropping them. Now we see, take a look down. Okay. And you've been feeling it all change up there. Again, you may have thought that you had things for, you have had things for a long time, but again, just to see what's chiropractic. All right, very good. What I'm going to do here is going to start working up from here now. I'm going to have you cross your arms like this. Hand on your shoulder, hand on the tip of your, on your side. There. Lift up your head here. Good. Drop your head back. What we're going to do here is going to start at the top, look down. Breathe in. Here we go. Breathe out. Here we go. Yep. Again. Yes, sir. Oh, yeah. And rest yourself. And smile as always. I say that the smile knows before the brain. The joints talk straight to the smile. The brain learns later on that everything is as good as the smile knows it is already. All right, very good. Let's do this side, on this direction now. Lift up your head, drop your head back. Good. From the top down. Here we go. Won't be like the first time. A lot of it's already done. There's some more though. We wouldn't want to miss a single one. It's like pebbles in a shoe. Only right number is 0. See if we can figure everyone out for you here. Get everything taken care of. Now, that's for the mid-back to lower. Let's go to the very top of the upper thoracic ribs. Here we go. And all their connections. Good. And we'll go this way. That's fine. And where you sort of pointed to up in here before. Breathe in. Let's see what we discovered. Here we go. And not a lot with that one, but we're going to come back later and check for more. Now, let's see what we find on the upper ends. If we lift up your head here and drop my hands. There we go. The first part of this is to check first with my fingertips, looking for the places most likely to still need adjustment coming. Now likely we're going to find some about there, and then way up here. One a little bit lower, one a little higher. If you've had this twist for any length of time, it had to zigzag, zigzag until it finally zigs and zags. Let's start with zig. This part is, again, positioning, not your adjustment. Bring it into position first. Still going to position you more. Back around. And then we'll pause. with your next breath, breathing in and breathing out. Here we go, with adjustment. Done, and rest. Excellent, just where we hope. Each time we're going to make sure that we take a moment, let the breathing bring you through it. Every breath helps bring you back from those first feelings. Now, position you, still position you. I'll let you know before the adjustment. With adjustment now, breathe in and out. There we go. Here we go. That one already, but there's more. All right. And great response. Go through it. Everything's just as I'd hoped for you. Released all the way to the base of your skull there. We've worked all the way up from below now. Zig and zag. Back and forth. Now, long pull from end to end. This will help coordinate all the adjustments we've done prior. There you go. Long pull. Here we go. We'll feel it all the way down. And now we're just going to rest a moment. I'm going to reach all the way to the top here. All you're going to feel is a little pulsing near my fingertips as we pause and I hold along the joints at the base of your head. And around your face. And I'm going to check your elbow. Good, elbow. And your thumb. Good, thumb. Good. Fingers. We're going to go fingers down, down, down. We're going to go fingers up, 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 and resting. We're going to go over here, elbow, elbow, fingers, 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 fingers. Oh yeah. There we go. Here, 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 here. Bring both arms above your head, way up tall. This is for your ribs and your sternum next. Here we go. Breathe in. Breathe out. Ribs, ribs, sternum. Good. There we go. One more time. There we go. Right. I always check in with everybody right about now. So far, so good?
Mm-hmm.
Everything's as I would hope for you at every stage. I'm going to have you now come up to sitting like riding a horse. One leg there. Yes, indeed. Stabilize. We're going to be checking everything again. I see you're checking yourself a little bit. Going up. We got more to do though. Let's see where we end up. Back to your hands like this. This is for your shoulder, your collarbones from the shoulders to the sternum. Shoulders rise up to your cheeks. Way out. Breathe in and out. We go. There it went. Big time. Click. Bring your arms above your head. Turn them backwards again. Both of them. Yes, indeed. One more time. Diver, diver. Drop them down. Here we go. Back to your hands. Back to your hands. Clapping seal position. Shoulders to your cheeks. Much better. Arm above your head. Back to your hands. Way up tall. Good. We're going to go right into a windmill now, like this. Now, you're going to bend a little at the waist here. That's it. This one's going to coordinate now in a twist from shoulder down to pelvis. Breathe in. Breathe out. Shoulder. Big twist. You're perfect. Excellent. First time on this dance floor here. You're doing great. Here we go. Over this way. Drop your head here. Bend forward here. Breathe in. Big twist. Oh, it went.
That was good.
That's what it's supposed to do. Nicely, nicely. Here we go. Now, if you'll turn over like face down, face in the face place here, and get these papers down. Face in the face place. Arms on the arm pads. There you go. Good. And ankle on the ankle pillow. Lift up your ankles and drop it. All right, what I'm going to be doing here, Kevin, is going through everything again. This will help enhance the adjustments we've already done. We'll be looking for more areas that still need adjusting. Have you take a nice breath in. Here we go. Toes. We've already done all these before, but again, a lot of that popping in your feet. Earlier you talked about various issues at the bottom of your feet, but we're going to look for chiropractic issues and see how much response you have in all different areas. Once you have thorough chiropractic adjusting, you'll be able to sort out this thing, this from that, maybe better than you have been. Here we go. There we go. Mid-body. Here we go. Mid-body. Good. And again. Mid-body. That's it. You keep it going. Keep it breathing. Oh, it popped. You know it. All right. Now, once this is off here, oftentimes this is off because they go back and forth. And so We've been twisted one way, oftentimes we're twisted there, so great. This one's a double handspring on both sides. Breathe in, breathe out. Here we go. Nice. Across the top, when you're ready, breathe in, breathe out. Over here we go. Good. One more time. Over here we go. Could be here still. Right there. Now, I'm going to take the bottom pillow. I'm going to have you come up to sitting like riding a horse, please. Sit up. Just push back until you not pull back until you hit my hand. Come back till you hit my hand. Arm one more. Here we go. And pause. Good. And break. Now, this one here, I'm going to take this hand here, please, to this shoulder. The other one underneath here. Under. Lift up your elbows. This is another twist that goes from end to end. Let's see what else we may find. Drop your head here. That's good. Maybe bending a little at the waist here. That's perfect. Breathe in. Big spiral from shoulder to pelvis. Excellent. And this hand. Go this way. Again, shoulder to pelvis. Oh, it moved. Oh, you know it. Right here. Right at the level of the 12th rib. Right where the diaphragm attaches. But again, as the pelvis moves like this, the 12th rib goes. And so oftentimes we've been stuck. And then everywhere else as it zigzags its way through the body. Now, one more time, I'm going to have you bring your arms above you, back to your hands together. And that's a complete set of adjustments. Here, it would finish it with this one too. And now after this, I would do some rechecks. But that's our first run through everything. At this point now, I'm going to be showing off various adjustments. The various parts of the adjustment are always 4 parts, which are doctor position, patient position, line of drive, and thrust. For the feet, starting with the little toe. Doctor position is where I'm at. Patient position is face up. This will be the line of drive, and here comes the thrust. Breathing in and out. Here we go. And again for the next one. One more time for the third, the fourth, and the big toe. I'll now proceed to adjusting the forefoot. First to the outside and the inside. I'll have the patient hold the top of the table. I'll be adjusting from the ankle, although the adjustment may go all the way up through any place else also, including the ankle. Breathing in and breathing out. Here we go. The thrust. Now I'll be demonstrating adjusting the knee, the foot, and the ball and socket joint. Breathe in and breathe out. Here we go. Knee and foot. We'll go straight to the ball and socket joint. Good. And down. And this will be demonstrating adjusting of the sacroiliac joints. Bringing the knee up and a half turn up on her side. I'll place her hands here and my hand here. I'll bring her further into position to get the line of drive. It's already started to release, and now with the thrust, breathing out and back and rest. I'll now demonstrate adjusting for the pubic region. Both knees up, please. This is for the interpubic joint and the 2 ball and sockets. Breathe in and breathe out. Here we go. Hold and rest. I'll now demonstrate adjusting the mid-thoracics to the lower thoracic regions, including the rib cage. I'll have her lift her head and drop it back on my arm. I'll position myself as such. I'll roll her forward and lay my hand behind her. I'm using a hand hold like this, hand position. Breathing in and breathing out. There'll be a series, starting here, here, and then, and rest. I'll now demonstrate adjusting of the upper thoracic region, including the ribs and their connections to the spine and to each other. In this adjustment, my hand is laying open like this. I'm using the thenar eminence to provide the point of contact. I'll have her take a nice breath in I'll roll it up on top of my thenar, my thumb, and thrusting through, and rest. I'll now demonstrate adjusting of the cervical region, including connections to the upper thoracics and to the base of the skull. And breathing in and breathing out. Here we go, with the thrust. And back. And rest. I'll now demonstrate adjusting of the cervical region, including its connections to the upper thoracic spine, ribs, and to the base of the skull. And breathing in and breathing out with the thrust. And back. And rest. I'll now demonstrate a straight pull adjustment, which will help affect every area from the spine down to the pelvis, from the top to the bottom. Breathing in and breathing out and rest. I'll now demonstrate adjusting of the elbow, wrist, hand, and fingers. Breathing in and breathing out with the thrust. And the thumb and the fingers. Down, 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 and down. Up and in, up and in, up and in, up and in, and rest. I'll now demonstrate adjusting of the ribs and sternum. Bring her arms above her. Positioning my hands, having her take a nice breath in and out. Rib cage, rib cage, rib cage, and sternum, and rest. I'll now demonstrate an adjustment that's a coordinating adjustment. It's going to go from her shoulder all the way to her pelvis to coordinate all the adjustments we've been doing from end to end. I'll have her put her arm over her leg. Her other arm will drape loosely over mine, having her bend a little bit forward from the waist because it's a spiraling motion that we're making. This is the position that we'll start from, then the thrust, breathing in and breathing out. Raising the shoulder and thrust and rest. I'll now demonstrate adjusting from the collarbones as they joint to the sternum and to the acromion of the scapula at the shoulder. I'll have her take her arms and turn in like this, raising shoulders up, breathing in and breathing out with the thrust. I'll now have her bring her arms above her, and again, breathing in and breathing out with the thrust, and down and rest. I'll now demonstrate face down adjusting of the foot, knee, and ankle. I'll have you take a nice breath in and breath out. Here we go. Knee, ankle, and foot, and rest. I'll now demonstrate face down adjusting of the thoracic region, including the ribs and their connections to each other in the spine. Breathing in and breathing out. Here we go. Thrusting, thrusting, and thrusting, and rest. I'll now demonstrate face down adjusting of the thoracic spine bilaterally. Breathe in, breathe out. Here we go. Thrust, thrust, there it goes. Thrust, yes, and rest. I'll now demonstrate adjusting of the cervical thoracic region from the upper cervical all the way to the base of the skull. Breathing in and breathing out. Over like this we go. Here we go. Thrust and relax. I'll now demonstrate a sitting adjustment that will be useful for the shoulder all the way down to the pelvis in the twisting motion. I'll demonstrate it both to the left and to the right. I'll have her take her arm and bring it to her shoulder, the other one underneath the other elbow. Lifting both elbows, I'll come through here to take a hold here. I'll walk around, step around, have her drop into a spiraling position, and taking a breath in. There we go, and with adjustment, and release. I'll now go from the other side, here, under the other one, lift up both. Again, I'll step around, walk around, have her bend a little bit from the waist, so into a spiral, breathing in with a thrust. Here we are, and it release. And pause and rest. I'll now demonstrate some sitting adjustments for the cervical thoracic region and all the way to the base of the skull. I'll have her drop her head over to my hand, and breathing in and breathing out with a thrust. I'll now reposition. I'll have her drop her ear to the side, and breathing in and breathing out with a thrust. And I'll position her here, back around my hand. I'll have her take a nice breath in and out, and again with the thrust. And rest. I'll now demonstrate sitting adjustments for the cervical thoracic region, neck and shoulder, all the way to the base of the skull and all their connections. We'll start with having her drop her head to her side, breathing in and breathing out here with the thrust. I'll now have her bring her ear to the shoulder, breathing in and out with a thrust. And now, one more time, I'll have her drop her head back against my hands, breathing in and breathing out with a thrust. And rest. I'll now demonstrate adjusting of the cervical region from the occiput to the thoracics and all their connections. We'll start with breathing in. She'll drop her head to my hand, and I'll finish with a thrust. I'll have her come the other direction, dropping to my hand, finishing with the thrust. I'll have her drop her ear to her shoulder, and again, breathing in and out with the thrust. I'll have her drop her ear to her shoulder, again with the thrust. One more series. I'll have her drop it against my hand back here, and breathing in. And one more time, breathing in and out. Here we go. And rest. I now will demonstrate adjusting the toes, and rest. I'll now demonstrate adjusting of the forefoot to the outside and to the inside, and rest. I'll now demonstrate adjusting the ankle and all the way up to the ball and socket joint. Breathing in and breathing out as she holds the top of the table, and thrust and rest. I'll now demonstrate adjusting the knee and the ball and socket region. This will also have an adjustment for the foot included. Breathing in, breathing out. Here to the knee, to the foot, and the ball and socket, and rest. I'll now demonstrate adjusting of the pubic region, the interpubic joint, and the ball and socket joints. I'll have her bring both knees up and press against my hands. Breathing in, breathing out. Hold my hands and rest. I'll now demonstrate adjusting of the sacroiliac region. I'll have her bring her knee up and a half turn on her side. I'll bring her into position further. And with a breath in, and a breath out, and a thrust. And back. And rest. I'll now demonstrate adjusting the thoracic region and the rib cage as it attaches to the thoracics and the ribs attached to each other. Breathing in. My hand is behind her. We thrust through. And again. And pause and rest. I'll now demonstrate adjusting of the upper thoracic ribs as they attach to the spine, and the thoracic spine attaches to the cervical region. Breathe in and breathe out, and with the thrust. Pause and rest. I'll now demonstrate adjusting of the cervical spine from the base of the skull, the occiput, down to the upper thoracic region. Breathing in and breathing out. And rest. I'll now demonstrate adjusting the arm, the elbow, the wrist, and the fingers. Breathing in, breathing out. Hand up first, and then down. Thumb, fingers, down, 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 and down, up, 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 and rest. I'll now demonstrate adjusting of the ribs and their connections to the sternum. Breathe in and breathe out. And rest. I'll now demonstrate a sitting adjustment that will include from her shoulder to her pelvis and all the way through the rib cage in between and the thoracic regions. I have a drape her arm over my arm and bend slightly forward from the waist. I'm going to take a nice breath in and breath out. We'll start with the shoulder, there it goes, and a twist, including down into the rib cage, and pause. I'll now demonstrate a face-down adjustment for the upper back, the cervicals, all the way to the occiput. Breathe in, breathe out. Here we go with a thrust. And back. I'll now demonstrate adjusting through the mid-body. Breathe in, breathe out, including the thoracics and the ribs and their attachments to each other, and rest. I'll now demonstrate adjusting of the knee, the ankle, and the foot in a face-down position. Breathing in and breathing out. Here we go. Knee, ankle, and foot, and rest. I will now demonstrate adjusting of the joints of the head and face using a balloon-assisted chiropractic adjustment technique. I'll position the patient like with any adjustment. We start with positioning. Like positioning my hands, I'll be positioning the aid to giving the adjustment. She may feel some unusual touching feelings back and there. I'll encourage her to have her hands here, and I'll have her take a breath in and hold her breath. At that time, I will close the valve and release. There's a big one. And pause. I will now demonstrate adjusting the joints of the head and face using a balloon-assisted chiropractic adjustment on the left side. I'll have her take a nice breath in and position the balloon, like positioning my hands through any other adjustment. We use the balloon to position there. As she takes a breath in and holds, in and hold, I'll close the valve and squeeze and release and rest. Again, I'm Dr. Stephen Berman. I'm going to be reviewing a paper that I wrote in 1990 titled Skull Dysfunction, subtitled A Skull-like Model to Explain Headache and Facial Pain, Birth Molding and Obstetric Trauma, Skull Joint Pathology and the Need for Treatment, and also subtitled Skull Joint Treatment Using a Nasal Balloon Device. This paper was published in part in an article in the Journal of Craniomandibular Practice, July 1991, Volume 9, Number 3, starting on page 268. A review of my paper here is by a dentist and a chiropractor, Dr. Curl, who reviews the paper and suggests that even well-trained dentists and chiropractors still lack in always helping as much as they'd like with problems of the head and face, headache and facial pains and jaw problems, that reading this paper might be useful to the reader who wants to try to help more. Your skull is joined from 22 bones that form 67 joints. It's by far the most complicated part of our skeleton. Most people know about the joints between the temporomandibular joint, but there's the temporal occipital joints, the temporal parietal joints, the temporal sphenoid joints. Oftentimes, a problem such as being called a TMJ problem, the temporomandibular joint being involved, well, oftentimes it turns out that it's actually a problem of the joints of the temporal bone surrounding the other parts of the temporal bone where it connects to the occiput, the parietal, and the sphenoid bone, and so that a dental problem may in fact be a chiropractic problem if the misalignment is in the skull. Again, 67 different joints of the skull. Many things trigger off headaches, and a list is here of all the different things, including emotional stress, menstrual cycle and hormonal changes, issues of the sinuses, fevers, congestions, headaches, changes in weather, high blood pressure, problems with the glasses and the squint muscles, issues of the spine and the jaw, even things as rare as tumors and aneurysms present themselves as headache oftentimes as a presenting complaint. Well, all of these have a mechanical stress upon the skull. The worry wrinkle that forms during emotional stress will cause the bones of the skull to be pulled further out of line, causing pains that may not be apparent until the mechanical force of the muscles are applied, then to become headache behind the eye or any number of other places. All of these triggers for headaches create a stress within the skull, either from the inside, from pressure increasing on the inside, or from pressure from the outside, or from torquing misalignments and other problems from the neck and the jaw and other places such as this. So to simplify then how headache forms, we see that many things are triggers, and most of the attention is usually placed to the trigger, but the common pain comes from mechanical stress in the joints, because no matter what the trigger is, the person points to the same place, regardless if they think it's an emotional problem, hormonal problem, eye strain problem. Regardless, the headache is the common denominator, so that all these triggers create mechanical stresses on the skull's joints. The brain, the joints fire off the pain fibers that have been found within them. The brain receives the information, and we perceive head and facial pain. Well, the first injury is in fact our birth injury. It's well accepted that at the time of birth, misalignment occurs, especially of the skull. Sometimes it's called cone head or stork marks, or any number of ways to describe what in fact is a life-threatening injury to the skull that has left misalignments throughout, oftentimes to linger through life. So again, early attention to the problems of the head and face and the skull need to be attended from the very beginning, attended to from the beginning. Treatment of the skull has gone through an evolution of working from the outside. We see here wiggling on the skull. Working from the outside again, here we see thrusting on the skull. But what we realize is that when we thrust from the outside, what we're doing is pushing together what already may have been jammed from birth and on from the outside in. So in the 1920s, this is a picture from the 1940s, but from the 1920s, chiropractors started using finger technique to try to get back to open up the bones and joints of the head and face. But it would always fail because we didn't have the right tool to help the baby, and even with the adult, the finger was too big. So back in the 1930s, there's a reference as early as 1938 in Denver. Dr. Barber shows pictures in a book of using an aid to replace the finger with a way to more effectively adjust the skull. This is a little pump from a blood pressure cuff. This is a little balloon. Oftentimes we use a finger cut to attach to the pump to create a system by which, when this is squeezed, this opens up. With an applicator that we shaped from a small wooden toothpick, we then place the balloon in the nasal passageway, not the sinus. The nasal passageway is a place in the spaces between the bones. The sinus is a hollow within a single bone, and the balloon does not go there. It sits within the nasal passageway, which is highly jointed. When placed there, and an adjustive force is given, just like with an adjustment to the body, but an adjusting force using the hand to express the force through the balloon to the joints of the head and face. Now pushing from the inside out in that line of drive for the first time, we were able to then accomplish true chiropractic adjustments accompanied with the same sounds, the cracking sounds that are oftentimes accompanying other adjustments. They now occur from the head and face, when no other technique will allow that to happen. The paper was reviewed, has its references, and I thank you for your attention.